Day one.
Day one.
Day one. Baby's born and the baby can get checked. Totally. The youngest baby I adjusted was 5 days old.
Wow.
Yeah.
5 days old. Hi, everyone, and welcome back to the Prudence Network. I'm your host, Prudence, and today we have a very special guest, and I'm in a very special place. As you can see, it's a very different set, and everything is different. I'm so excited to have my friend, Inga. I'll have her introduce herself. I usually introduce people, but she'd love to do this herself. You can go ahead.
Thank you. Thank you for asking me to do the podcast. Hi, I'm Inga. I'm a chiropractor and I specialize in female health, pregnancy, pediatric chiropractic, postnatal recovery, and everything around the female body.
Everything. All right. So, how are you?
Good, thank you. How are you?
I'm good. Are you excited?
Very excited.
Very excited.
Yes.
I'm so excited. You know, last week I thought it's last week, this podcast,
yes.
and I could not wait. So I'm here,
Aww.
finally. Okay, so before we get into the serious stuff, we're going to have an icebreaker.
Awesome.
So if you can lift your 10 fingers up, yeah? So if you have ever done it, you can put it up.
Oh, amazing. I love that.
You know it, yeah? Okay, right. So the first one, put your finger down if you've ever adjusted a family member outside of working hours. Oh, okay. Put your finger down if you've ever caught yourself analyzing someone's posture in public.
All the time.
Guilty!
All the time.
Guilty, okay.
Yeah.
Put your finger down if you've ever wanted to tell a stranger to look down on their phone like this. Have you ever wanted to tell a stranger that?
Yeah.
All the time.
All the time. Well, especially teenagers. Because
Teenagers.
they go like with their whole body. They don't
Crouching.
just do things.
Yeah, the whole
Yeah.
body is like bent
Yeah.
like this.
Yeah.
Okay. Put your finger down if you've ever been asked, can you crack my back at a social event? Oh my goodness, people. Okay.
All the time.
Right. Put your finger down if you've ever given health advice when nobody asked for it.
Oh, yeah.
Inga. Okay.
I would totally do that. Not as much anymore, but I used to.
Not
do
anymore.
that a
You
lot.
used to just giving out
Yeah.
advice.
Yeah.
Okay. Right. Put your finger down if you've ever carried your own child and immediately thought about spinal alignment.
Yeah.
Yes. Okay. Put your finger down if you've ever had someone imitate a chiropractic adjustment sound when they found out what you do.
Yes.
Like
You do this like crack, crack.
the cracking sounds. Okay.
Yeah.
How many do we have? Oh, so all this you have done. Okay.
Yes.
Put your finger down if you've ever been introduced as a person who fixes backs.
Yeah.
Like we have Inga here, she fixes backs. Do you fix backs though? Is it the word?
I do. This is what chiropractic is most known for, but
The back.
it's probably like 2% of my patients that
Yeah.
really come with back pain. So
What is it?
Yeah.
So there is a lot to do with
There
chiropractic.
is a lot more. Yes.
Oh, not just the back.
Yeah.
Okay, interesting. We have two. Put your finger down if you've ever had a patient teach you something about chiropractic. A patient comes and says, I think you should do it this way.
Oh, lots of patients who have seen someone else before.
Yes.
And then they want like the same thing.
Right.
And I usually work very different. So
You work very different.
Yeah.
Okay, and now put your finger down if you have ever tried to fix your own back. Because you're so busy fixing everyone.
Okay, you can't adjust yourself.
Yeah.
So it's not chiropractic, but yes, I definitely stretch.
You stretch.
when I had a busy shift or something.
Mm-hmm.
I totally do that. All of them.
All of them. Well done. Okay, now let's get into the kind of serious stuff. So, about mothers, I'm a mom, you're a mom. We have a lot of mom friends. Mothers spend a lot of years looking after babies, working, multitasking, carrying bags with nappies. It's a lot. Daily responsibilities at home as well, aside from work. What impact does that have on our bodies as mothers over time?
Over time.
Yeah.
So I would say there are two aspects of this. There's one, the physical aspect, where we usually do things always with one side. Yeah, so we have a dominant hand as either the left or the right hand. So with the non-dominant side, we carry the children to have the dominant side free to then do all the tasks, right? So I see that a lot, that we do things all the time on one side, and then the pelvis shifts, the back goes a little bit that way. You use one shoulder more than the other. Yeah, definitely.
Yeah.
That's like physically the main thing. And then we always do things like quickly. Right, we don't think about when we bend down, we don't think about using our knees, we don't think about how we do things. It has to be done.
Yeah, it has to be done.
Right.
Yeah, but I think as mothers, we cannot even think about that, about our bodies.
Yeah.
When we have to work, when we have to carry a crying child, we're just doing it.
Yeah.
And for me, I work with babies, and it's true that I do have this dominant side. And there is a point I had 3 under 2-year-olds.
Wow.
3 under 2-year-olds. And I had to carry on this side all the time. This one cries, I carry. And I think it's a huge impact on even the nursery teachers and people who work with children.
Yes.
Because it's mostly lifting up the babies and on the side. Oh, wow.
Yeah, and then as well, like putting them on the changing table, and when they are toddlers, they're a bit heavier, and you have to like putting them up, and lots of physical impact.
And we don't realize how heavy babies are, right?
Yeah,
because we're just thinking they are a baby, but it may be 4 kgs.
Yeah. Well, my son was born with 10 pound 3. That's 4.6 kilo.
Wow.
From day one. So yeah.
From day one.
Yeah.
How did you carry that big baby?
In a big tummy.
Okay, so talking about pregnancy, it changes the body in remarkable ways, especially your first pregnancy, from the girl to the motherhood. Which changes in our body or bones tend to have the biggest effect on the spine?
On the spine, the biggest impact, I would say, is definitely when the center of gravity changes. Yeah, so in the beginning, of course, everything really grows inside of us, and then we grow little by little. But as soon as the tummy really
grows bigger
and goes more forward, and then the pelvis shifts backwards, that's where the problems usually come in the first time in pregnancy, with pelvic pain, lower back pain, things like that.
So the impact of the spine on the first pregnancy, is it still the same with the second pregnancy? How the spine changes and everything? Is it still the same every pregnancy?
It's not the same as such. It's much quicker. One, when we haven't done anything about the shifts from the first pregnancy, they don't just go away. Right? We don't just bounce back and then we are exactly the same anatomy like before. All the little shifts usually stay because, again, as mothers, we just get on with things, right? So we don't do the right exercises. We don't see a chiropractor or osteopath or a physio after the first pregnancy unless we have really a problem. So all these little changes stick in the body or get really stuck in the body. And then the second pregnancy, where we see that the tummy grows much quicker.
Oh, yeah.
Yeah. In the first pregnancy, usually you don't see a lot until about 6-7 months. Second pregnancy, much quicker. Third pregnancy, even quicker.
The first 2 months, you are already walking like a penguin.
Yeah. And then it's very funny. I have 2 lovely patients. They're both pregnant with their third child at the moment, and they are in the exact same week. They're about 30 weeks pregnant now, and you could see it from week 10. that they're
Wow.
pregnant and
That
they
they
can't
are
hide it anymore.
pregnant.
Both of them.
You can never hide a second and third pregnancy.
Yeah.
Wow.
Yeah.
Yeah. But as mothers, man, we go through a lot.
Yeah.
We do go through a lot, and yeah, it's crazy. Also, we accept pain and the acts as part of our life. Like this is actually normal.
Yeah.
Which symptoms should never be ignored?
No symptoms.
No symptoms.
No symptoms should be ignored because it's so normalized that we have pain. It's so normalized that something hurts, that a movement hurts, that a movement is restricted, that we just pop a pill. It's so normalized. And this is, I think, especially when there's so much physical change going on, and as well, we carry so much emotionally, it shouldn't be normalized. Nothing. Just get checked. You know, it doesn't hurt. It's not invasive. There are no negative side effects of chiropractic care. You don't even have to get adjusted. Just come in, get checked, and then you know what's going on in your body.
You know, everything is normal, or I need help.
Yeah. Yeah.
I think so many mothers need to get checked because indeed we take it as normal. I do have a lower back pain. I'm on the way here. I do have. And you know what? I fell down the stairs.
Wow.
So that morning we had a trip to Scotland, me and my daughter. The plane, we had to catch a 5 a.m. plane. And then my daughter was still sleeping. So I had to dress up everything before I woke her up. When I was doing that, I just slipped and fell. And I tried by all means to avoid the middle of the spine. So I had to land on my bum, on my bottom. And there is a bone. What's the name of that bone?
The tailbone, the coccyx, sacrum.
Tear bone, I think.
That
one. And then I landed on that. And then I just looked down like, wow, that is so painful. I felt my whole body reacting. I just sat still on the stairs. And I just got up. I'm like, I need to carry on. We have a flight to catch. I just went down the 2 stairs, which were remaining. I continued doing, I just continued with my life. Got on the plane. I told my husband, but I just took it very lightly. Like, I'm strong.
Yeah.
The pain will go away.
Yeah.
But then about 5 months later, then I did not call an ambulance or anything or even take any tablets. 5 months later, I could not wake up that morning. I could not wake up. Like, I moved my neck, there was an impact. I moved my hand, there was a pain, like excruciating pain. And I called 999. That's how bad it was. And they had to come.
Well, what did they do? They gave you painkillers.
They gave me painkillers.
Yeah.
They gave me painkillers. And this is 3 years ago. They gave me painkillers, and I told them, the pain I'm in, and you're giving me painkillers. I feel like it's not fair because you did not even touch me. And I'm telling you, I fell down the stairs.
Yeah. It's just about switching it off and getting on with life.
So in my head, I did not even think about getting checked because I have 2 kids and I have myself to look after. So, ladies, never ignore. Yeah. So the pain comes sometimes, but it will go very soon.
Yeah.
After these sessions.
It's because our bodies are made to survive, right? Our bodies are made to get through life. So when you have a problem where the pain is just getting too much, the body adapts. So it changes things around. It will not use that segment anymore. It will just get stuck in that segment and then use other segments to do those movements. Our bodies are very clever. It will just switch the pain off. The problem is still there.
Yeah. So we get so used to the pain that it's now normal. We take it as normal.
Yeah.
Like we own a pain,
Yeah.
which is not good.
Yeah. And then we become this symptom. It's normal for us. If it's not there, we would even worry.
Yeah.
You know, you wake up and you check, is it still there? And then, okay, it's still there.
Yeah. Do you think there are patterns from menopause, no, from the young age, like we are, to menopause? Is there any effect on our backs when we are switching stages, or like milestones from pregnancy? Now we have the baby is out, now we are going to menopause. Are there any changes in our bodies?
100%. 100%, because we go through different stresses in life. And as well, so one part of that is definitely nutrition. Well, I'm not a nutritionist, but I see a lot and I read a lot about like what we really should be doing and taking to keep our bones and joints healthy. Yeah. And then as well, the better function we have in our spine, the better the segments move, yeah, the better quality of life we have. And that goes all the way through. So if a segment in the spine doesn't move properly, we have less nerve function and we have less blood flow in that area. So we have more degeneration. And if we have that already in our 20s and 30s, how can we expect that our bodies are just functioning right when we are 40, 50 and 60?
Yeah.
Right? So it's always important that the spine functions properly. And lots of people just look in your face and like, oh, you look healthy.
Yeah.
You're fine.
But it's
right?
what's inside.
But it's really important.
Yeah.
Like what's going on inside.
Yeah. True. Okay, right. So we're moving on to babies and children. What's the youngest age can you take?
Day one.
Day one.
Baby's born and the baby can get checked. Totally. The youngest baby I adjusted was 5 days old.
Wow.
Yeah.
5 days old. So what made the parents consider taking their baby to a chiropractor?
So with that little boy, the problem was that he preferred feeding on one side. He was not turning his head to the opposite side comfortably. So that was really the main thing.
Oh. And the parents, they just said, we need to see Inga.
Yeah.
Were they your clients before, or
yeah,
it was their first time on the baby?
The mom in pregnancy.
Oh, so when you were adjusting her, you were having conversations as well about the baby, in case. That's amazing.
I always have conversations with every patient, really, because it's important. It's, like I said, chiropractic is so known to treat back pain, right? So it's important that we talk about it. What options are out there, and who do I see, and what do I do in clinic, and absolutely.
Okay, so with babies, so how gentle are you with babies? Do they understand what's going on with them? Because like a 5-day-old, do they cry a lot? Do you have experience with babies not wanting your hands on them at all?
Yes.
Or your experience is just like it varies, it's everywhere?
It really varies. I always say like babies or children in general either hate me or love me. So there are babies who are like very attached to their mom and they don't want anyone else to touch them, me included. They don't know, I'm gonna help them. But what I see in babies especially is they love the adjustment and their body understands what's going on. So where an adult, for example, when something is uncomfortable or painful, we lean away from it, right? Where a baby, if you are in the right space, and adjustments are so gentle. It's like we would never apply more pressure than we would tolerate on our own eyeball or how you check an avocado if it's ripe. It's really super, super gentle.
Wow, yeah.
So there's no cracking involved. There's just like holding and really... Then when you're in the right spot and holding in the right spot, the baby leans into it.
Towards,
It's wonderful.
So it's like comfort as well to them? It's like a massage. Is it like a massage?
It's more like a pressure point.
Right.
Yeah.
Okay.
Yeah. But their body understands.
Their body understands. Yeah. Okay. And onto children, have you had... Let's talk about the 5 to 9-year-olds. Because they are really active and they fall a million times from the jungle gyms and all that. There is an accident every single time.
Yeah.
Do you have those clients as well that age.
Yes.
And how do they get settled? Because especially boys,
Yeah.
like having to understand, lay there and be relaxed. How do they respond, or how do they react to you having your hands on them?
I have that question a lot. So parents always ask me, like, especially before they book in, they say like, oh, but I don't know if he or she will like stay still.
Yeah.
And or parents just like from the first day, it's like, oh no, my child wouldn't stay still, no chance. I'm like, that's not what it is about. It's really about, one, in the beginning I talk to the mum and like go through really the most important questions, about everything what has happened, and then we adjust children where they are. Yeah, I can adjust a child playing on the floor. I can adjust a child on the mum's or dad's arm.
Wow.
Yeah, like from day one to, of course, if you can't carry
So
them,
it's
anyone
not
knows
always
on your
about
arm.
this.
It's not always about just having to lie down and be still. And a 4-year-old yesterday, he was lying on daddy's tummy. So daddy was lying down just on his back, and he was lying then on his front and then turned around on his back to get adjusted. And that's totally fine as well. My kids not always like to get adjusted when I saw my chiropractor with them. So they got adjusted at the front desk.
Yeah.
You know?
Just there.
Just like you really, my clinic is so child friendly, and I always say, if they want to empty the shelf with the water bottles and play around there, then
Let
they
them.
should.
Yeah.
You know, the most important thing is that they feel safe and happy when they come in, and not like have to lay down and have to do this. There's enough in life where we have to do things we don't want to do. That shouldn't be here.
They're children. So do you speak with the children before that, what you're going to do? And do you talk to them as you're doing it? Like, now I'm going to press over here. Do you communicate with them?
Yeah,
maybe a bit older children, or even the 5 to 9 year olds.
Yeah.
Do you communicate with them your next step? Now I'm going to do this. How are you feeling? Is it sore? How do you do that with the babies?
So from when they can talk, I definitely talk about what I'm doing. It's like, I'm going to press the tummy, I'm going to check inside the mouth, so please lift your tongue up. I'm going to check like inside, show me your teeth. It's like at the dentist. So we really compare things as well when they've already had the experience, like with another doctor somewhere else. Then it's really easy to let them understand as well what I need for them to do to be able to do that adjustment. Yeah. And then we check reflexes, and that's usually a lot of fun. Or I use a tool called an activator. I have some for kids. I have one. I have one here.
Like a little.
And that's the kids version. So it does a little click.
Okay.
So they can play around with that, and it should always be fun. And of course, I don't do something what they don't want to do. If a child would be here just screaming their head off, they don't need to get adjusted in that moment, because the adjustment wouldn't be effective anyway. Yeah. So, yeah.
And they will hate this place.
Yeah.
They will say, I don't want to see you anymore.
Yeah.
And it's very heartbreaking.
Yeah.
So have you ever had children who say, I don't want to go back there?
No.
But it's possible.
It is definitely possible. And
because you can never please all the children.
Yes. And I say as well, if the child comes in, and they just don't want it, I would not charge for it.
Yeah.
You know, how can I charge for something like that where I don't do the work or can't do the work in the moment? And kids are all different. Like, we all have a bad day. Let the child have a bad day. That's totally fine. I do have kids, definitely, they say like, okay, I don't want clicking today, or I don't want that in my mouth, or because I adjust the cranium, so the skull a lot inside the mouth as well. And that can be uncomfortable. So I totally understand. So then we just start little by little again and say like, okay, let me just check. I'm not pressing, it's not going to hurt. So I just check and really, really build a relationship with them, because nobody is fixed in one adjustment. And same as adults, same the children. So it's better to have a good relationship with a child than trying to do a lot in one visit.
So with children, school-aged children, because they do have screen time, a lot of screen time, does it have any effect on their physical body, not just mental?
Yes, absolutely. But I have to say, it's not just screen time. When I was 12, I was reading books right? And it's the same position we sit in, right? We slouch when we read books, we slouch when we're on the iPad, we slouch everywhere, and especially
when we're eating
as teenagers. When we're hypermobile, especially then. And it's just important to get checked again there, where some children really can see the effect on the posture, and then it's really important to do regular checks and as well do exercises for that. And some children with hypermobility, it's really hard work to sit upright for them. So they naturally slouch already because it's just like their body gets tired. But yeah, it definitely has an effect, but you can't blame it just on one thing, right? So it's all the things. When we are mums, we look down for our kids. When we have a dog, we look down for the dog. So it's like all these things create a bad habit, a bad posture. It's just important to know what you can do to then get the body better from it.
So we create our own postures, in other words. Because as children, I can see children slouching all the time. Is it because they are tired or it's too late already?
It's not. It's never too late. It's never too late to get adjusted and do something about the posture. It's just important that you know what's the right things to do. There again, it comes in, just come in and get checked, and then make a plan and see what other things you can change in your daily life to work against the bad position. And then, like I said as well, with hypermobility, it's like there are a couple of checks we do, so we know if somebody's hypermobile or not, and then we know they are easier to slouch because their body is just tired very quickly. So we just need to do implement the right things, right exercises in their daily lives to really help them.
I can see you are sitting really well because you tell people to sit well. We cannot find you slouching when you're spreading the gospel of
I do
slouching.
I do slouch a lot. Yes.
I think sometimes it has to do with the mind, like subconsciously you just find yourself, you don't plan to do it, but you just find yourself sitting like this. And for me, I'm tall and my husband is even taller. So for my husband now, he's got like a permanent, but I don't want to call it a permanent, like a slouch. For tall people, is it the same with short people? Because I see most tall people slouch a lot. Or short people are just trying to be tall walking, so they don't have that problem. And tall people are trying to be short as well. Is it the same in terms of the height, how we just slouch, or it has a lot to do with the height as well?
It does have a lot to do with the height as well, because especially when you are a teenager, for example, and you're taller than everyone else, you don't want to be that tall. So you automatically shrink yourself.
But you're still tall.
Yes, but you try to as well, because people can't understand you when you're too tall, and you try to get to go down on the height level of the other person. Plus communication is always easier when you're on the same height, and it's unconsciously you do these things. So with tall people it definitely has an effect, but again it's never too late. It's just important, what can we do, and you have to do it every day. You really have to, you create a habit of
consistent.
Having the positioning, so you have to create a habit of undoing that as well.
Chest out and
but it's it has different components where the body is then tight, because when you slouch, it has the shoulders, it has the neck, it has the upper back. So we need to check where it comes from, where the body is so restricted that you can't go back up anymore.
Okay, so don't worry, I'm fine. When someone says I'm fine or I'm just stiff, I'm not very flexible, what goes through your mind? Is there something like a stiff person and a flexible person, or everyone is flexible?
It's so different in everyone. So there are people who are very, very stiff, who have lots of restrictions in their spine and they can't move properly, where a hypermobile person will always be able to move without knowing how many restrictions they have in their spine, because the tendons and joints and muscles just move around it. So when somebody says that, just get checked. Again, it comes back to just finding a professional who knows what they're doing, get checked, and then you know what's actually going on in your spine and how well you're functioning.
So it can be changed, sort of.
Yes.
The stiff people, like maybe telling them to relax or having them to relax. Can that be changed?
It can definitely be changed. I have a lot of older patients at the moment who are just very stiff in their back. Yeah, they want to play golf, they want to do things, and they really can't because everything is like so stuck.
Yeah.
That needs just the right care.
Okay.
That needs repetitive adjustments. Then when the body starts opening up, then the right exercises. There's no pill in the world that will open up a joint and give you more mobility. There's just not.
Yeah. So we have passed on to children and we did mothers. So mothers, I'll just put it on middle age. On older people, they also slouch and some use walking sticks. Does that start from an early age, not realizing, for example, in our 30s, how we are slouching and not getting checked? Does it have an impact when we are old now, using the walking sticks? Or it's just old age, nothing to do with how we have done before, how we had bad habits before?
I would say it's more coming in age, and it has more to do with balance and that weakness in the legs, that then there comes the need in for a walking stick or even two crutches or a walker, the wheelie thing. There again, it's very important to do the right exercises, but finding the right person who can help in that situation. Because if you, for example, just have one walking stick, you will always lean forward. I see a lot of patients where the walking stick is not the right height, the crutches are not the right height, they're too low, so you even create a worse posture than you had before. When you get older, tension in the upper cervicals can create balance issues, but as in general, older patients have more problems with balance. There is actually research out there on chiropractic that positively can affect the balance in elderly patients. What's absolutely amazing, again, it comes to, it's not fixed in one visit, you really need the right plan, but that can really improve. And then when you feel more stable, then again, it's important to then follow up with exercises and try to use the walking stick as little as possible.
Oh, right. And try to balance by yourself.
Yeah.
It's better you walk slow than to have a habit of using the walking stick. Okay.
Yeah.
So do you have patients who are old, like old age?
Yeah, I have patients in their 80s, 90s.
So how does it go with their health, the health itself, because they may be taking tablets of a certain disease and everything? Do you first hear what's going on in their body or what they are ill with? Because they have quite a number of sicknesses when they are old. How do you balance between giving them a service and their health?
It's really important. So every initial consultation includes taking the whole medical history, and as well as to know what medication they are on. Not only to know what their body is going through, but medication also puts a lot of stress on our system, and medication can deplete our systems in the very essential nutrition. So it's really important on what health level then holistically again the patient is, and where we have to, for example, when we have patients with osteoporosis, that we are just very, very gentle with the adjustments. Yeah, it's always as chiropractors, we always have to get the whole picture of the patient, of every patient. This is why I don't adjust on the first visit as well, because on the first appointment we go through everything.
Right.
And when somebody says, oh, I forgot my medication, or I don't really know, I said, you can send it through. It's very important that we have that in the file. So it's very, very important when somebody has been through cancer, when somebody takes medication for reflux, for GORD, for any other inflammatory disease in the body, like arthritis, stuff like that. Just that I know.
Yeah. Yeah, that's what I wanted to ask. For the first visit, what can people expect? The first initial visit.
So the first initial visit is really to create a full picture of the body. Yeah, when somebody comes in with shoulder pain, usually when you see another doctor for shoulder pain, they will look at the shoulder. Here, I check the whole body. It's always important to check the whole body because shoulder issues are not always originating in the shoulder. They might come from the neck, they might come from the upper back, they might come from a problem, a misalignment in the pelvis, and then adaptation in the upper body, and then creating shoulder problems. So it's really important. So I always check the whole body from head to toe. I check all neurological function in the body,
Right.
all reflexes, how our skin feels on both sides of the body, and then mobility as well, how our muscles function, but as well as like how much range of motion we have in every joint of the body. And then we go deeper where we check the area that they feel discomfort in to see if there's any orthopedic testing we need to do to find out if there's a disc involvement or if there's a facet irritation, like really what's the problem in that area, not just where it comes from, but what is the problem in that area. So we really know what we need to do care-wise.
Yeah, carefully. You mentioned arthritis. So arthritis is about bones, right?
Yeah, inflammation in the joint.
Also, it's bone inflammation.
Yeah,
It
in
has
the
nothing to do
joints.
with not visiting a chiropractor.
Yeah.
Is it linked, or it has nothing to do with not visiting the chiropractor and the chiropractor checking you and all that? Like, what's the link? What is the link with arthritis?
There's not really a link, I would say, per se. Like arthritis is just inflammation, not just.
Yeah.
Arthritis is inflammation in the joint. There are
Yeah.
different types of arthritis. There can be mild arthritis from overuse in one single joint, or there
Oh,
can be
right.
arthritis really affecting the whole body, where we see bilateral, so left and right in the same joints, progressive inflammation, and then change of the bones and the joints.
Also, it's about the joints, mainly about the joints.
Yeah.
Right. And then
Yeah.
here we are dealing with bones, not the joints.
The joints as well, yes.
Okay.
So I can adjust everyone. If
Right.
you have arthritis, I can adjust you the same as if you don't have arthritis.
Yeah.
Yeah, it's just really important. It's like, where is it? How does it
Yeah.
affect the body? Again, like, how do I need to adapt my adjustments
Yeah.
that the patient
Suit
is not
you.
in more pain when I
Right.
adjust, and afterwards as well.
Okay. So chiropractic care is often misunderstood by so many people. Some don't even know something like this exists. And it's very true. Some don't even know the definition of it. To those who know, there are myths about this, like, if you go, you're going to break your back. If you go, it will not work. What are some of the myths you have heard people talking about?
Oh, there are loads. I think mostly chiropractic is really what's the word? Seen as the same as physiotherapy, as osteopath, and as massage therapist. So we are all thrown in one pot where we all do everything so differently.
Is it?
I love to work with other practitioners. I love to send my patients to a physio or an osteopath or a massage therapist or acupuncturist to then go into the next phase of care, or to help with a certain area to speed up recovery, or to then, when we've been through the acute care plan, to then help with in-depth exercises in that area where they're needed to build the muscle again.
So you guys are totally different.
We are totally different. We all work with the body. I think that's where it comes in, that we are like the same.
Yes.
And we help with symptoms and pain, where as chiropractors we look really at the function of the spine mainly, but the rest of the body. Physios are amazing in doing the exercises, and then to like really work on the muscle. They do dry needling, and they're really specialized in their areas, same as osteopaths. Like, they are specialized in their areas. They do an amazing job. It really depends on what your body needs.
Yeah. So on the myths, some people say it's dangerous. Like what you do with the bones, sometimes there are sounds.
Yeah.
So do you have a limit, or you're okay, you're so relaxed when bones are cracking. You're like, I'm used to this. Have you ever had like an accident with cracking the bones and someone had to be rushed to the hospital?
No.
No. 100% no.
No, 100% no. One, I always say when somebody's in here before and they say, oh, I don't really like this, I heard that's going to crack, that might hurt. I always say I wouldn't be strong enough to hurt someone, to really hurt someone.
Yeah.
What can be is that you have already inflammation in a tendon, and with an adjustment, the tendon gets like pressed in a certain way, and that can be uncomfortable.
Yeah.
But I'm not able to paralyze someone or break someone in a certain way. Same with babies, or same that we can pick up on the pregnancy side again, because in pregnancy it's always said that in the first 12 weeks we are basically not allowed to live our life anymore, right? We have to stop everything because pregnancy could end, or we could harm the body. I don't agree with that because especially in the first 12 weeks so much is happening in our body, and the first thing that develops in the baby, in the fetus, is the spinal cord. It's the nervous system.
It's the first.
So having the mum happy, emotionally being okay, physically being okay is the most important thing. And then again, with the first pregnancy, it can really feel like somebody kicked you in the stomach. Right?
Yeah, that's
like
true.
The first couple of weeks can be so uncomfortable. And I remember I was 8 weeks pregnant and I was in so much discomfort and I just wanted to get adjusted. So I did. I have patients coming in, they come in regularly and they say, oh, I've just done a test, I'm pregnant, probably a couple of weeks. So I'm just careful.
You're just careful. Yeah.
I just work around it. I'm very, very gentle. Still, I check if the pelvis is in the right area, because pelvis alignment has to do with pelvic floor function and the positioning of the organs as well. So, yes, it's always very important, and it's never dangerous. A chiropractor should know when to adjust and when not.
So, is it the same with babies that you can work on the pregnant lady, even sitting, doing anything, like even lying down? Because I understand they mustn't sleep on their back for long.
Yeah.
So now they are 7 months pregnant and the tummy is over there. Do you have them sleep on their back, or you are trained to work on pregnant ladies? How do you work with pregnant ladies?
So I always, especially when it comes to when they're halfway through pregnancy or towards the end, I always ask if they are still comfortable. It's always important to check them in general. You would see if somebody is already like on low energy or doesn't really feel well, and then check them through the adjustment. I do have a special table what I can tilt. Yeah, so they are like a tiny bit tilted and not lying all the way on their backs.
Oh, okay.
Yeah, so just to make it one more comfortable and to avoid them getting dizzy or having any other problems.
Or any risks,
Yeah. And then the same, I want everyone to be able to lie on the tummy, to be able to get adjusted. So I have a special pillow where they can put their tummy in and lie very comfortable.
Looks very comfortable.
Even
when you're not pregnant, I'm definitely using it.
It is very, very comfortable. And the kids use it as a boat. So we are set up here to see pregnant women every stage. And if somebody's not able to lie down, then we adjust them sitting. So it's all possible.
You accommodate everyone from babies until old people, everyone.
Until their last day.
Except animals.
Yes. There are animal chiropractors out there. They do an amazing job with what they do. Yes, absolutely. A friend of mine just qualified. Yes.
Amazing.
But I think I'm good in what I do.
You're good, yeah.
But not with animals.
So do you also take men? Have you ever had men clients?
Yes, totally. Yes, absolutely. Men with all sorts. They come in usually for the pain and aches they have, and then the women send them in to check the cranium for like snoring, mouth breathing, stuff like that. Anything else? Just get checked. Yeah.
So how often do you recommend someone to get checked? They come for the first consultation, and the second one, it's maybe the practical one. How often do you recommend, and when does it stop?
When does it stop? That's a really good question, because there's like a myth out there that if you see a chiropractor once, you have to go forever. I personally would love to go forever. I get adjusted since I'm 16. I now at the moment go once a week because I feel that's the best for me. So when you come in, that really depends on what you come in with. And then it's really important to find the right frequency and the right plan individually for that patient.
For you.
Yeah. So that's why it's so important to really see, is there an effect on the nervous system where the body's not supplied the right way, left and right, so they need a bit more care. If somebody comes in and can't walk straight, then of course they need a lot of care because they really need to heal, and healing takes time. And there's lots of research out there about frequency of adjustments and time as well. So it's really important to consider all these things, one experience in clinic and one the research, to then put the right plan for everyone individually together. Kids usually need to be seen a bit less, adults a little bit more.
Right.
And we see the best effect when we see someone 2 or 3 times a week.
Yeah, so everyone is different.
Yes.
It may be the same age, but still different situations.
Totally.
Right. So is it normal that people say backache comes with age? Is it something expected that back pain comes with age?
It is one of these things where everything is so normalized.
Yeah.
Right? So it's very common.
It's
not
common.
normal, and it shouldn't be there. As well, we see degeneration in the spine. We have 33 segments, right? 33. And then we have degeneration in 2 or 3 segments. Is that aging? Or is that because the body is adapting that area so much that then degeneration happens in those segments? Because if it would be just aging, degeneration would be in all segments, right? In the same way.
So we mustn't normalize it.
No.
So it's possible we can have an old person without a backache.
Yeah.
Living their life.
Yeah, totally.
Wow.
Yeah.
Wow. But it's never too late to get checked when you're old, to start like the first consultation at 8 years old.
Yeah.
Never too late.
Yeah, it's never too late. I have a lady in her 80s at the moment, and it's quite funny because she always tells me that she doesn't believe in chiropractic. And
is it? Wow.
It's very sweet. She's a pharmacist, and she's absolutely lovely. And she came in for her first appointment, and then she said, yeah, it's a bit better now. I don't need to come back. I told her the plan and that I would like to see her a bit more often. She decided she doesn't want to. I was like, fine. Now, I think it's like 6 months later, now she comes regularly.
Wow.
She used to wear a neck brace. I recommended not to wear it anymore. She was a bit hesitant because that was her safety and her comfort, when now she doesn't wear it anymore, and she's in the right frequency of care, and she feels improvement without the neck brace.
Wow.
So it's a lot about like just keeping the door open and educating.
Yeah.
Yeah, but it's definitely never too late.
It's never too late. Okay, so with old age, it's not normal. We mustn't normalize it.
Yeah.
So the question is on the pregnancy now, because we are just moving like this with our pregnancy, like we are pushing ourselves.
Yeah.
Is it normal that pregnant ladies get the lower back pain? Is it normal? Is it expected? Is it normal?
Common.
Yeah.
It's very common. And then we are told, oh, it's just take a painkiller.
Yeah.
When the baby's out, it will go away. That's always the same comments what we get, where I'm like, you don't have to live with it. You should be able to enjoy your pregnancy, same like every other day of your life.
Yeah.
It shouldn't be normalized, because why should it be normal to be in discomfort? It's not nice. And I got adjusted throughout both my pregnancies, the whole way through. And at every stage, so you can be getting less adjusted in the first stage of pregnancy, and then something shifts and you're not as comfortable. So you just get adjusted a little bit more frequent until you're comfortable again. That's how I see it. It's like really going through all those stages in pregnancy and really seeing what works the best for you in that moment. Yeah, I was with my first one, I was 42 weeks pregnant.
Wow.
I was gigantic.
That's a big pregnancy.
Ginormous. Yeah, she was 9 pound too, my first one.
Yeah.
And I was huge, but I was comfortable. I was very comfortable. I was like planting
Wow.
in the garden. Like I still have videos. I still remember. Like
Yeah.
I wanted to go to B&Q and put plants in the garden. It's like crazy things you think you need to do
Wow.
when you're
At 40
pregnant.
weeks.
At 41
Wow.
weeks. Yes. Well, in my second pregnancy, I was very uncomfortable in 38, 39 weeks. So,
So we
very
mustn't
different.
normalize pain, like
No.
the whole life itself,
Yeah.
from a young age to old. And are there parents who see themselves that I think my child needs to see a chiropractor? And what have they seen for them to say, I think I need to take my child to a chiropractor?
It's usually content nowadays. It's like there are videos out there everywhere, and this is where it's so much easier for us as chiropractors to really talk about like what we do and who we see. It's still wording wise, it's very limited because we are regulated, right? We are regulated, and then there are different restrictions what we are allowed to talk about. But I can show a video online and say this is a normal adjustment for a 3-year-old, or this is a
Right.
normal adjustment for a 15-year-old. And then people see that and it's like, oh, my child has this and that. It can be like headaches or growing pains or stuff like that.
Yeah.
Would you see them? And I'm like, yes, of course. Yes, of course. Just come in, get checked. It doesn't hurt. You don't have to get adjusted on the first, on ever. You
yeah.
don't have to. It's your choice.
Yeah.
Yeah. But just coming in, getting checked, seeing how the body functions and what is the main cause of the symptoms happening. And then you can decide if you want to work on that or not.
Yeah.
Yeah.
Okay, as we go to the conclusion. Right. So stress, does it affect the physical well-being of a person?
Yes.
Because it's happening in the body. And I'm just sitting. I'm not slouching. I am just stressed. How does it affect my body?
Yes. Stress can affect us in so many different ways. So it can be chemical stress from anything we eat or we are exposed to. It can be emotional stress, especially in women. Men as well, absolutely, especially in women. Emotional stress can happen in children because kids copy their mom's and dad's nervous system, right? In the first, I think it was 7 years, what I read, that the kids copy the nervous system of the parents. So when the parents are very stressed, or the mom is already very stressed in pregnancy, has an effect
On the
body or on the baby.
Yeah.
Yes. And then to physical stress, any bumps, bruises, falls, surgeries, accidents, everything what happens in the body.
It's a lot.
Yeah.
Yeah. So I think it starts from the inside for it to be out.
Yeah.
Okay, so
Yes. In chiropractic we say it's above down, inside out.
Inside out.
Yeah.
Okay, so about this amazing place, are there like memberships, or it's you pay once for the consultation? If you think about coming back, you pay again. If you think for the third time, you pay again, or there are plans?
So we have plans. We all the time we have different offers, because I think the first step going into chiropractic care or starting about something new, the biggest barrier is the price, right? So I just had a special in half term for children. So I offered the children an initial consultation and adjustment for £30, because the first barrier is the price. If somebody's £100, you think about it 3 times if you really need it. Can that even help? It's like all these things. So we regularly have promotions and offers to help people making that decision or taking that part out of making the decision. And then it's really about the first appointment, and then depending on how much care they need, we do offer payment plans for individually for their care, and we do offer a membership as well for maintenance care. Yeah, like I said, I get adjusted every week. That's just what works for me. I usually recommend coming to get checked every 3 to 4 weeks,
Right.
usually, especially with the amount of stress we are exposed to in our daily lives.
Yeah, true. So the first session, which is the consultation, is the really important one, isn't it? For you to know your body, and for you to decide. Yeah, I think it's really important. So,
but as well to know where we start. So when you're on a care plan, of course you start feeling better, and then you're like, oh, why did I even come in? That can happen as well, because we get used to pain, but we get used to feeling good as well. was absolutely amazing very quickly.
Yeah.
But we really need to have the big picture of why did we start, what did not function properly when we started, and then we do regular checks and really see how far the body comes and what we need to adapt in other exercises or adjustments as well to get the body to the next step.
To go. All right. Right. Okay, everyone. This is the beginning of the end, actually. The beginning of the end. So if there is anyone listening, maybe it's a mom, it's a sister, or even a man, you can still share. Anyone can listen to this. You can still share what you have heard today, and you can book an appointment. You can book with her. You can book with any chiropractor, because what's important is to look after yourself, is to be healthy, is to be happy, is to be comfortable, and it's not to normalize pain, which is the world we are living in. We have taken all abnormalities to be normal. Like, it's okay, I usually have this back pain, it'll go away. But then old age is coming and it'll be worse. And we have heard it's never too late. So, Inga, what difference, as the last question, do you think that will make health or family, that will make a family's well-being healthier in terms of this chiropractor? What do you think? What advice do you have for families? What advice do you have for pregnant ladies, for old ages? Do you have any advice in terms of visiting and how important this is?
If you feel any discomfort, or even if you don't feel discomfort, just get checked. Just
Simple.
get checked, do an initial consultation, know how your body functions. Because we always think like, oh, you look healthy, you're healthy. Oh, you're not in pain, you're healthy. But how does your body really function on the inside? That's really important. I had a baby in on Saturday, just yesterday, and the mum just wanted to get the baby checked.
Yeah.
Little one was 6 weeks old, and she just said, oh, I heard about you. I just want to get my baby checked.
That's
awesome.
Yeah.
That's awesome. And then I want to send a message out to all mums. You're important as well. Yeah. We always look at everyone else first. The baby, the children, the partner, the dog. We get our car checked, MOT,
Everything.
all these things. And when we really struggle, it's so normalized. So normalized. And that again can be physically or emotionally. And when our bodies don't function right, we can't cope emotionally that well.
True. We need to have our MOT as well.
Yes.
It can be weekly.
Yes.
Yeah. All right. Thank you so much, everyone, for joining us on this podcast. Inga, right? Inga has social networks. Where can people get hold of you if they need anything, any help, if they want to follow you, if they want to comment on your posts? Where do they find you?
So the easiest way is Facebook or Instagram. It's IB Family Chiropractic Shirt. That's the best way. And as well, if you want to find your own chiropractor in your area, I'm always happy to help.
Thank you.
I have patients traveling for an hour and a half, so it's like a 3-hour round trip, and I make sure that they find a chiropractor also near them, so they don't have to travel that far. It's like, it's a bit tricky when you're specialized in a certain field, area, like pediatric chiropractic. I absolutely love it, and there are not as many out there, but for just a general chiropractic care, just send me a text, say where you live and you want to find a chiropractor near you. I'm definitely happy to help.
All right. Thank you so much. So
Thank you.
until next time, we may be back again together.
Yes.
I don't know what we'll be talking about, but we may be back. So take care, guys.
Cool.
Don't forget to like, subscribe, comment, listen to all the networks. We are on Spotify, we're on Apple Podcasts, we're on YouTube. Yeah, see you. Thank you.
Thank you. That was so cool.
I loved it.
I want to do more.